Hey everyone, Dr. Jeff Peng here. Wrist pain is extremely common and can be very easily treated through a home exercise program. So the goal of this video is to teach you an exercise routine to help relieve the pain in your wrist. Let's get started. Now, if this is the first time you are watching one of my videos, my goal is to help each and every one of you live an active and healthy lifestyle. So if that's something you're interested in, please consider subscribing to my channel. Okay, so what are the most common causes of wrist pain? The first is tendinitis or tendinopathy. Tendinitis is caused by an injury or trauma. This results in inflammation around a tendon, and that leads to pain. Tendinopathy is an overuse condition. It's caused by repetitive stress or overloading of a tendon, and that leads to gradual wear and tear. Both of these can be rather painful. Now, the other common cause of pain in the wrist is a wrist sprain. There are a lot of very small ligaments in the wrist, and ligaments help provide stability to all the wrist bones. Any of these ligaments can get injured when they're stretched or overloaded. Chronic loading of these ligaments can lead to instability and pain. So the goal of treatment is to first offload the area to allow the wrist time to recover. This will involve activity modification and oftentimes wearing a wrist brace. Now, there are two types of braces for the wrist, one called a volar wrist brace and another called the thumb spica splint. If you have pain at or around the thumb, you're probably going to want to get the thumb spica splint because it's going to provide more support and more protection. Otherwise, the volar wrist brace is sufficient. And depending on the injury, I usually have my patients wear their wrist brace for anywhere between 1 to 2 weeks to help protect the wrist. These braces are readily available at any pharmacy or online at Amazon. You're going to want to wear the wrist brace throughout the day as well as at night when you sleep. Now, once the wrist starts to feel better, then it's very important to get on an exercise program to help strengthen the muscles and tendons around the wrist. This helps the wrist recover further, and it allows your body to withstand the loads you are putting through it. Okay, so this is just one example of an exercise program for the wrist. Now, you're always going to want to start off with a warm-up just to get things loose. So rest your forearm either on a table or on a chair, and just work on flexion and extension. You just have to do this for 10 times, so just like this. So 2, 3, 4, 5, 6, 7, 8, 9, 10. Then work on clockwise for 5 times. So 1, 2, 3, 4, 5. Counterclockwise. 1, 2, 3, 4, 5. Okay, now we're going to move on into some strengthening exercises. And the first exercise we're going to work on is wrist extension. So I have a light dumbbell here. You're going to want to rest your forearm on some type of support. And what you're doing is we're going to first do our first set of 10, and the goal is to do 3 sets of 10. So you just want to rest your forearm down and then just extend your wrist just like that. So 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, when you are first injured, you may not be able to tolerate heavier weights or even a water bottle, and you may need to just first start off using no weight at all and just to get that range of motion back. But eventually, as you get stronger, start to use a little bit heavier weights. Again, water bottle, can of soup, maybe a 2-pound dumbbell, and then progress. Remember, 3 sets of 10. Okay, so the next exercise we're going to work on is wrist flexion. And again, we want to do 3 sets of 10, or at least build yourself up to 3 sets of 10. So again, rest your forearm on a table, have the wrist dropping off, and then just rotate the wrist up just like that. So drop your wrist down and then rotate it up. And we'll do our first set of 10. So 3, 4, 5, 6, 7, 8, 9, 10. Remember, the goal is to get up to 3 sets of 10. Okay, so the next thing we're going to work on is grip strengthening. Now, because we immobilize our wrist and after an injury, you tend to get a lot of muscle atrophy. And so the goal of this is to rebuild strength in all of those small hand muscles. So get a stress ball or a towel, crumple it up into a ball, or just hang on to a dumbbell and just squeeze. And what I want you to do is squeeze for 5 seconds. So 1, 2, 3, 4, 5, and then relax. Rest for 2-3 seconds, and then squeeze. 1, 2, 3, 4, 5. Relax. Squeeze again. 1, 2, 3, 4, 5. And do this for a total of 10 times. Okay, so the next thing we're going to do is to work on some simple stretches for the wrist. And this is really important to help improve range of motion and mobility. So what I want you to do is to fully extend your elbow over here, drop your wrist down, use your other hand, and then pull back. And where you're going to feel this in the back part of your wrist as well as all along the extensor compartment of your forearm. The goal is to hold this for 30 seconds initially and then slowly build yourself all the way up to 1 minute. So the other thing we want to do is we also want to work on the flexor compartment of the wrist. What you want to do is to fully extend your elbow. This time, bring your wrist up, use your other hand, and then pull backwards. And where you're going to feel it is on the bottom part of your wrist as well as the flexor compartment of your forearm. Just like the extensor side, we want to first start with 30 seconds and then slowly build it up to 1 minute. This simple exercise program is meant to be done daily to help rehabilitate the wrist. You can also check out this next video where I talk about various other options to help treat muscle and joint pain. Thanks for watching.